The Healthy Kids Community Care is a school-based healthcare clinic that provides medical, dental, vision, and mental health services to children without health insurance or with other barriers to accessing health care. The clinic began in 2007 and has served over 1,400 students.
We have had enormous support from various aspects of the community, from pharmacies, from ophthalmologists, optometrists, doctors of many, many specialties who want to help because they have a close realization as healthcare providers that there is indeed a need. And that is something I think a lot of people who live in our community don't realize.
Healthy Kids Community Care was developed in 2007 to help fill a gap of unmet needs of our students in the school district. Since that time, we have served over 1,500 children, ages 0 to 18, to provide free medical, dental, and mental health services.
The clinic is held 2 times per week with locations at Northwest and Southeast junior highs. The programs are open to all children in Johnson County through graduation age. The clinic is staffed by 2 pediatricians, a pediatric nurse practitioner, a child psychiatrist, and the clinic coordinator. Why a school-based program?
I think the real advantage of a school-based clinic is that a school is perceived as a safe place by parents. So families that are sort of just figuring out how to use the medical system or are from another country and they're uncertain about how to access things, they feel very comfortable coming to the school. We also can interact with all of the resources that the schools have in place, the family resource workers, the school nurses, teachers, counselors. It's really of benefit to help children whose families don't have the resources and sometimes don't know where to begin.
Benefits to students and families.
We Family Resource Center help the families to get the students to the clinic. And first they call the clinic, and it can be a referral from a teacher, a coach, a parent. There's a lot of people involved in the student's health. So when they come to me as a family resource person, I call the school clinic and I ask to help them make a referral. And this can be for children who doesn't have insurance or they are new to the school district and they don't know where to find a referral. So the first thing that they do is to come to the school and find out, and then we talk to them about the school clinic.
The school clinic helped us arrange the necessary primary health care and gave them a checkup. It's to say that the school clinic helps to make sure my children are healthy. They can take advantage of the days at school, and they are able to learn more at school. And that way, they don't get ill, and they can continue with their studies. These are some of the benefits I've seen at the clinic.
We didn't have insurance since we just moved here, really, and I wanted to do sports, and so did my brother, so we needed to get our physical. So we came to the school health clinic and did that.
I had an earache and a fever for a couple of days, and my dad had just lost his job, so we didn't have health insurance anymore. My mom had heard about the school clinic from the school nurse. And I saw the doctor at the clinic, and she gave me medication, which made me feel way better.
I'd been to the regular doctor for a physical, and I needed some booster shots. It was a really small appointment, so my mom couldn't get off work, and so I got them at the student clinic instead. Now I'm vaccinated and my mom doesn't miss work.
Over 1,200 students received school-based mental health counseling, psychiatric services, and/or mental health case management in 2012-2013. The most common mental health conditions affecting students are depression and anxiety.
I feel so fortunate to have this opportunity to have the services here in the school because it brings our care to where the children are throughout their day. This is where they live. This is where it affords me an opportunity to collaborate with other individuals that are working with these children. So the extra information is vital, and probably foremost is what it does to enhance access to mental health treatment for these kids.
community partners.
You know, it sounded like a program where there was definitely a need for eye care. These people coming from, other regions, having, maybe some cultural and language barriers, and if they had a vision impairment on top of that, that could really stand in the way of their being successful. Over 80% of learning is through your visual system, so if these kids can't see in the classroom, that, in addition to the other factors, they're at a huge disadvantage.
Get involved.
The needs of our children in this school district are not going to go away. I would urge everyone who is viewing this presentation to give strong consideration to helping us ensure the viability of Healthy Kids Community Care school-based healthcare clinics.